Welcome, everybody. Good morning. Good afternoon to those of you on Eastern time zone. My name is Jonathan Schoonover. I'm the Senior Vice President of Strategic Practice here at Tennesseans for Quality Early Education. And this is another one of our communities of practice gatherings on the Early Educator Workforce. So looking at workforce development. Today, very excited to talk about a topic that has been on I think everybody's minds since we said we were going to start a community of practice, and that is compensation strategies. So excited to kind of dive into that. Before we do, just as a reminder, TQEE is a nonpartisan coalition of advocates for Tennessee's youngest learners. And what that means is that we're really focused on advancing state policies and practices that ensure that all Tennessee children from birth all the way through third grade get the high quality care and education that they need to power our state's future. As a part of this, you all are part of the Bright Start Tennessee Network, which is the statewide network of community partnerships that's really focused on closing achievement gaps and opportunity gaps, and then helping children from birth through third grade. As a part of this, we now have a growing community of 8 cohorts across the state. The first cohort, or 8 communities across the state. The first cohort was our first 6 in Knoxville, Nashville, Memphis, Chattanooga, and then the 2 rural blocks in Northeast Tennessee and in West Tennessee. And our newest communities are in South Central and Upper Cumberland. So excited to have everybody joining as a part of that. We know that to get to third grade reading and math proficiency is kind of our North Star, that it takes all 3 of these domains functioning well. So that's high quality birth through age 8 learning environments. It's physical health, mental health, and development all being on track beginning at birth. And then it's supported in supportive families and communities. And the way that we've kind of put the framework up for that is that each of these have 5 measures of success that we track and provide data for your communities on to kind of look at and kind of follow this as we go. So I won't read through all of this. You guys are part of the Bright Start Network. And as we started this community of practice, really as we kicked it off at the Align Summit last year, the idea was that each of the communities in the initial 6 cohorts were all focused on early care and education, and really were struggling across the board with some sort of trying to put together some sort of strategy on workforce development. And so we kicked off the Align Summit and we developed this community of practice out of this, and have been having every other month have been having these meetings to talk about a specific topic of interest that you guys have shared. So today is another one of those that we're very excited to share. Here's a quick view of the agenda. We'll do a little welcome intro. This is part of this now. And then we're going to dive in and talk about compensation strategies. Have a great guest today with Albert Wat. Blair will introduce him shortly, but we'll do Q&A. We'll sum things up, and then we will give you guys some time on this call to have some breakout strategy time. And then one of the things that we've heard feedback from you all that you say is valuable is that time when we then come back together and share kind of what you've done in this cross-pollination time to kind of understand like what you took out of this and what you think you're going to do with this. And then we'll wrap up an eval and should be able to get you out of here shorter than the 2 hours that we have allotted for this. So looking forward to this today. Before we jump in and introduce our guest, I'm going to highlight and spotlight one of our fellows, Jennifer Andrews from Chattanooga is on the call, and we just want to highlight some of the work that's being done in Chattanooga on the last topic that we talked about. I think it was grow your own a little bit, and then it was also marketing as well. So those kind of things together. But I'm going to spotlight Jennifer if you'll come on video, and I will spotlight you right here.
Thanks, Jonathan. So we have some great work happening in Chattanooga, Hamilton County, great conversations going. Tanya Henson Brooks is the lead of our Early Childhood Educator Workforce Working Group, and we meet every other month on the alternating months of this community practice. And since we have had community practice meetings, there have been some great conversations happening between the 2 local higher education institutions and the school district about Grow Your Own. We've had some speakers on to talk about some local apprenticeship projects and potential there, as well as a deeper explanation of our local Grow Your Own context for the rest of our working group members. And then we're also having some deep conversations about a childcare marketing campaign for the Chattanooga-Hamilton County region. And we talked about it some as a small group on this community of practice last time, and we brought that to the bigger group. And simultaneously, there have been some side conversations from a local funder who might want to help us make that a reality. So we're super grateful and have had some conversations around what that would focus on. Do we want to, how we can raise the prestige for the position while also, kind of leading towards a greater action in the community, changing the public will and the mental model around childcare, getting more teachers into the field. Can you make one campaign do all of the things? So still exploring that, but excited to see where all these conversations go, and grateful for the community of practice to give us those best practice ideas.
Yeah, thanks for sharing. I think one of the things that was exciting to me about this, and one of the tenets that we have within this Bright Start network is that obviously utilizing state resources and any federal resources to maximize those that are available to us. But what's really cool is when communities have developed early care and education plans, and you've got kind of a menu of options. When a funder comes and says, "Well, what will I do? What lever do I pull on? How do I help with this?" You had like right off the top of your head, like, "Hey, I've got a whole bunch. Here they all are." And so it was really cool to kind of see that. So I just want to highlight that and spotlight that. Thanks for all the work that you're doing in Chattanooga and Hamilton County. Cool. All right. I am going to now bring up Blair Taylor, our president and CEO, and we'll have her introduce our guest and kind of go from there. So Blair, I will kick it over to you.
Hey, everybody. Good morning and good afternoon. Great to be with you always. Our topic is one that we all have front of mind, compensation for the early educator workforce. We today are going to mostly talk about childcare workforce compensation. We recognize that there is a shortage, an early educator shortage in the childcare space, private childcare space, as well as in the LEA, the school district space, the VPK to third grade. But bulk of what we'll be talking about today is the childcare space and the compensation strategies there. Though we may touch on a little bit on the other as well. The childcare space, I don't think I need to tell anyone on this call how incredibly difficult it is to, the business model just doesn't work without outside investment, additional investment. It is, we all know how important it is to have qualified, prepared, early educators working with our children who ideally stay in the job for a period of years, and there's not a lot of high turnover, but attracting and retaining talent is very difficult because primarily the only way that our childcare providers are able to generate revenues is from the parents who pay, and childcare is already unaffordable to parents. So it's this conundrum, and without outside investment, I and others in the field, strong believers that without outside investment, we can't make ends meet. So I'm excited for Albert Wat to be here today. Albert is a friend and colleague and someone I admire greatly, very well respected on the national scene. He worked for the Alliance for Early Success. I'll let him tell you a little bit about that organization. He's also worked for the National Governors Association on childcare, early educator policy, early education policy. He's also worked for the Pew Charitable Trust prior to that. He's just really an amazing person, and I'm just excited that we get to have him here to talk a little bit about what's best practices and things that are happening to spark our imaginations and inspire us on the policy side of things. I do think most of what we're going to be talking about is state policy stuff, but there's some things and examples that will have taken place on the local level as well. And so right there, I'll just go ahead and stop and turn it over to Albert. We're going to try to keep this conversational. So as Albert's got some slides, 4 or 5 slides. As he's going through those slides, you guys put questions in the chat that come up for you. I may chime in and ask him questions to try to keep it conversational. I'll be keeping an eye on the chat and try to, as you all have questions, kind of bring those in. And then we'll also have time for Q&A, as Jonathan mentioned in his agenda slide. We'll also have time for Q&A afterwards, and then we'll go into breakouts and come back. So with that said, Albert, you want to introduce yourself?
Absolutely. Thank you for having me here. I'm, as I said earlier, I'm a big fan of TQE. I've seen TQE since the very first day, and seen it's grown. And I've also witnessed the sort of the birth of the Bright Start project, and also nice to see it grow as well. So it's a pleasure to be here. So I am a senior policy director at the Alliance for Early Success. Those of you who might not be familiar with the Alliance, we are at our core a community of state and national advocacy and policy organizations that are all working together to advance early childhood policies and investments in states. And so we're very focused at the state level. We do this by providing grants to state level advocacy organizations like TQEE, and we have grants in all 50 states plus DC. We also provide funding to a network of national organizations with the express purpose of allocating or leveraging the resources and expertise to support what state advocates are doing. And then on a day-to-day basis, week-to-week basis, we facilitate a lot of peer learning and peer support opportunity like this one that you guys have in this network throughout the year, both in small ways and big ways. Yeah, so I think let's dive right into it. So if you can move on to the next slide, I want to start by providing some general or before I actually get to these resources. So what we actually you can move on to the second slide. Sorry. What I'll cover today is I'll provide some information about what states are doing in some of the bright spots we're seeing in terms of increasing wages. Also benefits, what's happening on that in that respect, and then also go over some what I would call like foundational work that even if you can't invest significantly in some of these strategies, like what can the state do to kind of set the foundation for these kinds of strategies in the near future. So on this slide, I just want to let you know that there are some general resources that have been out there that you can use yourself. And I know you can't click on these links, but we'll obviously send you these links later. But the Center for Study of Childcare Employment, for example, has put together a compensation tracker for a number of years to exactly as it says, to like keep track of the more significant compensation strategies across the country. Child Care Aware of America just put out this state policy dashboard that includes also some information about significant financial support for early education workforce around the country, and also other policies for at the systems level that you might be interested in. For us, the Alliance for Early Success, we did put out a report last year, at the end of last year, really trying to elevate the significant reforms that states have that have been implemented during the pandemic, since the pandemic, so that for the last 4 years or so, and compensation obviously is one of them, so that might be a resource for you. Homegrown has a resource that is specifically focused on home-based providers, family childcare providers. So for those of you who are interested in that sector, part of the system, that might be a good resource to look to. And then finally, the Bank Street College of Education has this publication called Paths Forward to Salary Parity for New York. Even though they did it for New York, it's the information there, I think it's relevant, applicable to pretty much all the states. So I want to name those. On the next slide, we'll start digging into the wages, like what's happening in states in terms of increasing wages. So the first thing is, of course, as everybody knows, I think, most states are doing have been doing some kind of wage supplement, and again, in small and big ways, or kind of tax credits for the workforce. I'm not going to go into that very much because, it's pretty standard at this point.
We have, Albert, I'll comment, in Tennessee,
Yeah.
we have the wages program, which is administered in our state by the CCR&R. And it's funded through the Department of Education, the Department of Human Services. Right.
So what I want to look at is more deeply is how states are aligning subsidy reimbursement rates with the cost of quality. So we see that in a number of states are moving away from the market rate to using market rate to determine subsidy to approaching a cost of quality model. And as they're doing that, they are intentionally thinking about what wages should the workforce be getting as part of that cost of quality model. So as you can see on the slide, DC, New Mexico, Virginia, and more recently Massachusetts have been implementing increased subsidy rates to support providers with the implicit understanding that, you know, by doing that, providers can increase compensation. So in Massachusetts, for example, they're raising rates from anywhere between 8% to 34%, depending on the age group, setting, or region. And I mean, their goal is for all providers to be reimbursed at least 80% of the cost of care. Two other states, Vermont and Indiana, are transitioning into that approach. Vermont just approved the rate increase by 35%, Indiana by 20%. So you can see this is happening in both blue and red states.
I might also mention, Albert, too, just for our audience here, there was a bill this year, and it's not dead yet, but there is a bill this year that was trying to do just this, that would require Department of Human Services to use a cost estimation model to then set the reimbursement rates for subsidy system. And it has been amended down to be just a study, which we think would be a win in and of itself, just to do the analysis so that we can educate our policymakers about how much childcare really does cost when you pay your workforce effectively. So I just wanted you all to know, and that's also came out as a recommendation from our childcare task force here in Tennessee. So it's something being discussed. Our Department of Human Services has not, as of today, been supportive of taking this approach, but I think it could be a great opportunity for our state.
Yeah, definitely a good first step to take. So even though you can increase subsidy rate, increase in subsidy rates could mean that providers are paying compensating their workforce higher. It's not really a guarantee, right? The providers still, within the system can do whatever they want with these increased rate, not whatever they want, but they can use a variety of purposes. So some states have started using contracts and grants as a more direct way of increasing compensation. So what that usually means is that, if a provider opts into getting a grant or contract, that usually will pay them at a higher sort of per child rate. Then if they opt into that strategy, they're held accountable to paying the workforce, paying early child educators at a higher level. So for example, in DC, they created the Pay Equity Fund that sets up this approach where providers can opt in, and then if they get a contract, then they have to pay by a certain level. And I'm going to drop a link into the chat where it shows you the sort of the levels that they are paying, that they're asking providers to pay through these contracts.
Yeah, Albert, I love this strategy. I love the contract strategy. And I want to just go back for a second, if you don't mind, for the cost reimbursement. We're getting some questions in the chat and some back and forth about, why might DHS not want to do the actual cost of quality study and tie reimbursement rates to that? And I'm gonna float what I think might be a reason, and I would love your perspective back on it. But there is a limited pool of funding that we get every year from the federal government for childcare. In Tennessee, it's in the neighborhood of $200 million. I think while I can't speak for DHS, but I do know that there is, often a trade-off that we have to keep in mind between stretching those dollars to cover more people versus higher rates of pay. So the more you use those dollars for higher rates of pay, the less dollars you have available to spread across more parents and families. And so typically, in many states who would do this, use a cost estimation model, they would be looking to have state dollars appropriated to complement the federal dollars. We currently in Tennessee do not use any state dollars to pay for our childcare subsidy system. We exclusively rely on the subsidy rate. So I just want to, I can't speak for DHS. I certainly know they have been raising reimbursement rates, periodically and fairly steadily for the last while, but that may be a reason. Albert, any comments on that?
Yeah, I think there are definitely trade-offs. Actually, the next example I was going to give, Illinois, they have something called Smart Start Workforce Grants that was passed last year, and they put in about $130 million, and they're rolling this out this summer. And what that does is, again, it's a grant that providers can get if they agree to meet certain minimum wage or sort of a minimum wage floor. And so they had to do some analysis of like, if we raise the minimum wage floor this much, then that means that fewer providers will be able to access this grant versus if you put it at a lower level, then more people, when you have working limited funds, those are the trade-offs that you have to consider. And so for Illinois, what they ended up was, they have a minimum wage floor of about $17 to $18 an hour for family childcare providers, and about $18 and $19 for centers. And again, I'll drop the link into the chat so that you can see for yourself more details about it. Minnesota also created a separate sort of pot of money that they call a Great Start Compensation Support Payment. It's a permanent grant, so subject to appropriation as usual. This grant will exist for as long as it's in the books. And this one, they are using it to continue the monthly sort of wage supplements that they've been providing providers and educators since the pandemic. So it works out to about $400 per FTE in this model. And they did fund it for looks like $300 million over the next 2 years. They have a biannual budget. So I will put the link here. And so I don't know why. Okay, there we go. And then
just for everybody, I know, just a comment, just to let everybody know, we will be providing all these links back to you. We'll provide a recording of this session, as well as all of the links that Albert has that he's put in the chat and that are embedded in his presentation. So just want you to know those will be available.
Right. North Carolina, just to round this out, North Carolina also did use this approach, but they only did it as a pilot using ARPA dollars, federal relief dollars. My understanding is that a lot of providers did take it up and were able to use that to pay people higher. Again, they have to adopt a certain sort of a scale that North Carolina recommended. So so I think that's another state that you can look to.
I love that model. And contracts too, aren't they, Albert? Positives of contracts too is they just create more stability for providers.
Absolutely. Like if you pay the typical model, right, in childcare is that you get reimbursed. So you provide a service and then you get reimbursed later, which from somebody who started with working in K-12 education, like it just, when I learned about it, it's like just like bonkers. So like by contracts and grants, by providing that upfront, like exactly, it provides that kind of stability.
And the new federal rules, we just heard from Grace Reef with CED, kind of briefed us a couple of weeks ago on the new federal rules for the CCDF fund. And one of those rules is going to be requiring states to use some contracts. It doesn't say how many or specify, but that's that's certainly a positive.
Yeah, and for certain populations.
Right.
Yes, absolutely.
Right.
I do want to mention that I think one trend and maybe innovation that I'm seeing related to these strategies is that states are setting up a sort of a separate fund outside of the subsidy system in order to ensure that the money goes to compensation. So as I said earlier, you can increase subsidy rates, but providers, there's a lot of holes to fill in our system, in our childcare system, unfortunately. So they could be plugging up all sorts of different holes and maybe leaving a little bit for compensation. So states are beginning to set up these different funds so that it's dedicated to compensation. So again, the DC, what I mentioned before, DC, Illinois, Minnesota, all those 3 states have set up a different pot of money for that. And then I listed a few other states: Massachusetts, Louisiana, New Mexico, All those states also have created different funds, a set aside fund for early care education, although not specified for compensation. But I think that just the idea of we can't, we can't really stabilize and grow this system and improve quality just with a subsidy sort of pot of money is an interesting kind of thought, sort of innovation that I think states are beginning to kind of act on. So let's go to benefits in the next slide. Unfortunately, there's not as much to talk about benefits, and it's definitely not as magical as this graphic makes it look like. But there are some things that are happening in this space. So, I mentioned there are a number of states that are have provided health benefits to at a systems level to early childhood educators. So California recently did this with collective bargaining, which I know is not something that a state like Tennessee and other states can do, but it is worth mentioning that they had a union and they did collective bargaining, and as a result was that they now have healthcare benefits and also retirement benefits for early child educators in the state. DC, again, with that pay equity fund that I talked about, both increases compensation and there's a part of it that goes into healthcare, providing healthcare for the workforce. I put Nebraska here with the asterisk because they proposed a bill a few years ago that basically put early child educators in the same benefit pool, healthcare benefit pool as public education teachers, public school teachers. And it didn't pass, but I want to mention it just because they found that it was like they could do that, and the K-12 committee was actually behind it. That was not why it didn't pass. And so again, I think sometimes it's just important to, even when the bill doesn't pass, to like put out a proposal, get it out there, and so others, maybe it'll pass in the next round, or others they can look at it and learn from it. So I think that happened in Nebraska. And then Washington State did something interesting during the pandemic. They did use federal relief dollars to set aside some money to help educators pay for healthcare premiums. And as they were rolling that out, what they ended up happening, what they learned was that, yes, that was helpful. And I'm looking at my notes, about 400, so they did this in 2021. As of early 2022, they had 400 childcare teachers enrolled through that fund who were not eligible for Medicaid. But as they were rolling that out, what they learned was that unfortunately, so many of these teachers are eligible for Medicaid, and they did a lot of work to leverage kind of that navigator system for Medicaid to get even more people enrolled to the healthcare benefits through Medicaid. And you can do the same for the Affordable Care Act, the marketplace, right? Under the ACA. There's also infrastructure that the early childhood education system can leverage to get more people enrolled in those health plans. Another kind of benefit that a lot of states have started working on is loan forgiveness. So in Vermont in 2021, they created this loan repayment program that provides up to $4,000 annually to reduce their student debt. But they do have to commit to working in a licensed program, a regulated program in the state for 12 months if they take that benefit. And then the last thing on this list is something that you might have heard about and you might be even talking about, is this idea of extending categorical eligibility to for childcare subsidy to childcare teachers. And because guess what? Some of them can't access subsidy themselves, which is kind of ironic. So Kentucky was sort of the innovator, was the first to come out doing this. And again, I will put a link in the chat for the language that they have use. And what I put in the chat is actually there's a lot of stuff in there that is not about this, but there's like 2 lines, I forget, I think it's section 3 or section 4, where you can find the language. But basically what it is, it basically made licensed center-based and family childcare providers eligible by disregarding their income from eligibility termination. So one side note is that, I wonder when people are going to think about, like, if we can disregard income for subsidy, childcare subsidy, what else can we disregard income for in terms of other benefits? So that's just something that I wonder if people were going to be talking about some more.
Yeah,
So-
Albert, and I just wanted to make a
Yeah.
comment about Tennessee on that too. We've explored this and even thought kind of middle of last year bringing some legislation for it. We had a conversation with Department of Human Services. Um, they said from their perspective was that no legislation was needed, that they could pretty much already do it. Certainly it is true that from an income eligibility standpoint, tragically, many of our early educators are eligible for the subsidy available for low income parents. That said, two things continue to stand out for me and why we may need legislation, in my view, which is that number one, I think there are providers who are over that threshold, who are in the middle income sort of what do you call that, spectrum of income, of household income, and who do not qualify for subsidy and who absolutely meet, who are early educators. We also something in conversation with Kentucky, they talked a lot about the importance of marketing and positioning, using it from a marketing standpoint to really say, you are special. This industry is special. Early educators are special to us. There is a special scholarship available for your children. This is a benefit exclusively for you because you, or not exclusively, but for you because you mean a lot and you're crucial to the industry. And I think the marketing is so important.
Yeah. And it just doesn't sound right or seem right that like childcare teachers can't get assistance to provide their own children with childcare, right? Like that just doesn't, some I think would rub people the wrong way. So anyway, so Kentucky did this first, and now about 9 states have implemented it in some way. Some more pilots that have expired. But this also includes states like Arkansas, Iowa, Oklahoma. Again, like this is not I mean, obviously Kentucky started it, so it's not a blue state kind of thing. There are some are doing it through legislation, some are doing it through administrative policy. There are 3 states that proposed it this year: Nebraska, Illinois, and New Hampshire. And I haven't heard whether they passed or not, but again, it's kind of catching fire a little bit. There's one state. So there was a debate in the community, in our advocacy community, about whether licensed family child care providers can take a subsidy if they're if they're made eligible, can use that subsidy to serve their own child in their own home. Now, none of the states that we have talked to since, like that we have learned about, are doing this except for one. Massachusetts is at least on paper, and I'll put the link in the chat, allowing, at least on paper, if you read it, it says like family childcare can do this, can use a subsidy to serve their own child in their own home. Now, when we talk to the advocates, they actually didn't know until this policy was sort of on paper. And so when they talked to the agency, I think there's a little bit of like hesitation to broadcast this too widely to people because they don't know if the agency actually talked to the feds about whether this is allowed or not. Maybe they just did it and asked for permission. I don't know so I have no idea how the decision was made in the agency, but it's on paper, it's there. And given that this is only 30 people or so, like I'm not really sure about sharing it, but they are kind of, I've talked to the advocates and they are like, yeah, maybe not, don't put it out on our listserv at this point. So
Albert, just curious, some of the debate around that, around childcare, family childcare, kind of the whys of, pros and cons, from various perspectives of family childcare. Is there a world in which you could care for you could get childcare paid for your own child as long as you're caring for other people's children as well? Or is there, just talk a little bit about the debate?
Yeah, I mean,
points.
So even then, I think most states have thought of, when they think about that, they haven't gone there. They haven't allowed family childcare to serve their own children, even if they're serving other kids in that space.
Kind of like paying for homeschool. We have a lot of homeschool debate here.
Right.
About so maybe using public funds to pay for homeschool.
So maybe if homeschool is a big thing in your state, maybe it'll pass, maybe people are more permissive about that. But I think there's a debate about the language, and I can send Blair some notes from a discussion that we had with advocates. There was some debate about the language in the federal regulations. Some are saying, doesn't sound like you can do it. Some are saying, well, it's at least a gray area. I've heard that you can actually, the state agency can actually ask OCC, the Office of Child Care, the federal government, for like a decision or for interpretation. Like you can I've heard that you can do that. I don't know that any state have done that, but if you're interested, you can do that. So but one thing that when we were talking to the advocates was which to think about is that there are some states, right, that count, if you're a family childcare provider, licensed family childcare provider, if you're serving your own child in your own space, some states require you, I don't know if the Tennessee is one of these, they require you to count your child as part of your group size or ratio, right? So some advocates are saying, well, if you force people to count their own child as part of the, like, meeting a standard for group size and ratio, why can't you pay them to care for that child, like for a subsidy? So there's seem like internal inconsistency, and if it is indeed that the federal government doesn't allow you to do that, there seems like there is some internal inconsistency about like how they treat how the policy treats providers' own children in the regulations. Yeah, so there's that. I can send you some notes if you're interested in just kind of
Right. No, thank you.
a little bit more. So let's look at the next slide, which is more about, again, sort of looking at some foundational things that states can do, whether or not they invest in these strategies. So one thing Blair already mentioned and I already mentioned, is the cost of quality studies. And, I think it's really helpful to just be more intentional about, or we'll deliver about how much quality services cost, and like moving away from the market rate and actually coming up with an estimate that you can advocate around, even if you can't invest money in it in the short term. So I'm going to drop a link here that is from the Prenatal to 5 Fiscal Strategies group that is one of the several groups that is doing a lot of this cost modeling work. They have a map that they track of like where these studies are being done. And so it's not, a lot of states are doing it. So I think if you want to, if peer pressure works, you can tell your agency like, hey, this is not a crazy idea. So that's one resource. And then in the orange box on the slide, there are a couple of other organizations that are also doing these cost of quality studies that you might be interested in. And then the other thing that I would say is sort of a foundational thing that you can do is developing an actual salary scale that so that you can put a stake in the ground about like how much early child educators should get paid if we have more resources. And so again, Washington State has done this, DC has done it, as well as North Carolina. The pilot that I mentioned earlier, where they use federal funds to provide contracts to providers if they follow a salary scale. This is the salary scale that they are using. And again, I'll put it in
And Albert, I'm assuming salary scales are kind of sensitive to geography and location. So rural, urban, you're going to have differing, wages and compensation levels, I would imagine, based on cost of living. Is that kind of how it's playing out?
Yeah, I think that you should be part of the design of that. And, ideally you wouldn't have so you would differentiate by region, but you wouldn't differentiate by like age group served or whether it's a school
right.
center. Like you would try to there are certain values that you want to make sure you have going into the exercise. But yeah, I think that makes a lot of sense. And again, there are some resources for developing salary scales in that orange box that you can look to the yeah. So I think that's something to consider.
And again, just going back to that, when you talked about contracts earlier, contracts combined with a salary scale can really allow you to sort of leverage, hey, we're going to contract with you, we're going to give you these funds. One of the conditions is that you're aligning your compensation rates to this wage targets, wage scale. Is that right? So it's a great way to, resource the wage increases.
Yeah. And then the next thing on the slide is about raising revenue. So as Blair mentioned, we can't do any of this work without, at least in a significant way, without additional resources into the system. And, hopefully the federal government, for what it's worth, did, as you probably know, increase CCDBG money in the FY24.
Albert, can I pause you before you continue with the raising revenue? Just a quick question on developing a salary scale. Jennifer Andrews had a question about, could salary scales be implemented, perhaps at the local level and not just at the state level? Have you seen any of that?
I'm sure it can be. I suppose, you know, in the more in more localized control, like states with a more localized control where the county is, you know, is providing grants or contracts, like they could probably do that and like ask people in that providers in that county or region to adhere to a certain salary scale. I don't see why not.
Yeah, we do have, I know we're stalking most state policy. We do have a few communities in Memphis, in Tennessee that are that where their local governments, either county or municipal governments, have dedicated some resources to, and even philanthropic resources in some cases. That typically is happening in our larger metro areas that tend to have more government resources available to them. But just a side note, I know certainly Memphis and Shelby County have made a big local commitment to investing in early childhood and pre-K and other things. And then Chattanooga, I know the Chattanooga community has too. And so, and philanthropically, so have other communities.
Yeah, certainly if it's not state money, if it's local or philanthropic dollars, then yeah, you can definitely, you know, create an initiative that you know, uses a salary scale at a local level. So in terms of raising revenue, you know, I for one am very glad to see that I think there's increasing engagement in earlier child community with especially with advocates to think about revenue these days. And so here are some examples of some states that have been able to raise revenue that is dedicated to early care education, not always compensation specifically, but early care education in general. So Louisiana has used tax on sports betting and even specialty license plates and to
everybody knows right now, by the way, Promising Futures, it's up in House and Senate Finance Committees behind the budget. House Bill 785, Senate Bill 750, Becky Massey, Mark White are the sponsors, and we are hoping to get it across the finish line and get it funded. At least as a pilot, it would be it'd be a big deal, and it's a long shot, but we're pulling out all the stops. So email your legislators, everybody.
Yeah, and in Louisiana, they set up this fund that is basically a matching fund for local investments. So if the local government decide to invest their own dollars in early care education, the state will match it with this fund that these dollars go to. Massachusetts and DC did this with raising taxes on high-income individuals or households. Vermont increased about 0.44% of their payroll tax. That is dedicated to early care education. Washington State, which doesn't have an income tax, created a capital gains tax that has been challenged, and so far it's holding. You know, it's still around, but it's been going through a couple of challenges legally. New Mexico, probably people know a lot already, have heard about a lot already, is using a lot of the oil and gas revenue.
And they have like a historically gigantic fund. Yes. Right, yeah. Albert, like just
in addition to that, in the oil and gas money that they passed an initiative to dedicate those funds to early care education. They also have, even before that, they had an endowment that the state put into place, and so there's actually two different funding streams now going into early care education. And people would say when you talk about New Mexico, well, we can't replicate that. We don't have oil and gas. But my message is like every state has money. Even the poorest state has like revenue that is being generated or income that's coming in somewhere. And yes, some states are easier to pass revenue kind of strategies than others, but every state has something that they can think about as far as some kind of tax or revenue generating strategy. Yeah, and then again, so raising revenue, there's a Children's Funding Project is an organization that is part of the Alliance Network. They do cost of quality studies as well, but one of the things that they rely on them on is helping our states think about potential revenue generating sources to fund early childhood programs. And then I think the final thing I would say is that, and this kind of gets back to not just the salary scale, but it is something, bring back North Carolina again, because I think they did a really sort of deliberate job when they were developing salary scale, really engaging the early childhood education sector, the educators and providers themselves. They did really extensive like surveys and focus groups in order to come up with that scale. And I would encourage, if you go down that road, that is part of the process. And really, really just, in general, right, when you're thinking about developing compensation strategies, whether it's wages or benefits, really kind of engaging the early child education sector, practitioners, in terms of like what works, what doesn't work. Because here's the thing, like the Washington State, when I mentioned the benefits that healthcare benefits that they appropriated money for, the advocates who did that when I talked to them, they admitted that, like, we really didn't engage the educators that much. And so like, they wish they had done that because, as I said earlier, a lot of the people who were able to get enrolled in healthcare benefits were doing it through Medicaid or through the ACA. And if they engage educators more, the advocates, even though they were very successful at raising money for healthcare benefits, they would have like also kind of looked into other ways that they can expand access to healthcare for the early child educators. So I think just kind of, learning from people who are actually doing this work, who have the lived experience, I think is really important in everything that we really talked about today.
Yeah, Albert, I really appreciate that. And I know I'm seeing an amen on that in the chat, and the importance of really engaging the folks who have the lived experience and who are going to be the beneficiaries of the work in the end. Crucial to have their voices shaping the policies and informing the policies. So thank you for that.
So I think that's it. And I think the last slide is probably my contact information if people want to reach out to me. But I will turn it back over to you, Blair.
Awesome. Well, as usual, that was just incredible information coming from you. Covered a lot in a short period of time. And I know we'll all be eager to dive into some of those links and learn a little bit more. Let's just pause here and just see. I don't see any additional questions in the chat, but see if anybody has any questions, any comments they'd like to share, anything they want to learn a little bit more about here with Albert with us. Anything about any of the states he mentioned you want to hear more about and how they did it?
A quick question. I was wondering, in the talks for increasing investment, is the private sector ever talked about at all?
In terms of philanthropy or in terms of business, what do you mean by private sector?
Private debt. So I mean businesses. How because this also affects businesses, how are we asking them to put some skin in the game?
Yeah.
Go ahead. Sorry.
Well, I was just going to let you guys know Andy, thank you for that. That's a great point. And there is a lot of emphasis in our state right now on encouraging businesses to come to the table as partners, employers to come to the table. We just had a lunch and learn a couple of weeks ago, maybe it was even a week ago, with Dana Glenn, who is with the Department of Human Services. She's their director of licensing, and they have a grant opportunity out and available right now, rolling grants that partners, that nonprofit together with employers, partners can apply for. To engage businesses in that. And so we'll be sending out today the sort of recording on that, as well as some of the answers to the questions that Dana went and gathered for us. So those will be going back out. And again, that goes out to the full Bright Start community, and you all will have access to that. But there's a lot of emphasis on how can you incentivize employers, and some states have tax credits to incentivize employers, and we've had conversations, TQE has, with our Department of Human Services and our Department of Community and Economic Development about what tax credits may be available. We do not have an income tax here, but we have franchise and excise tax. And so there's been some looking into what tax credits. We actually had one on the books a while back that was available, and it was sort of underutilized. The question is that because employers didn't want to use it, or because they didn't know about it? So these things also have to be marketed. But those are some of the things I know about from Tennessee that we've been having conversations with state officials about. Albert, anything else you would add on that front?
Yeah, I mean, a number of states in recent years have created these like cost sharing kind of programs where the business would pay for part of the cost of care, and then the provider pays part of, supports part of that, and then the state. So like Michigan, they have that tri-share program. In Wisconsin, there's something called Partner Up. So it's definitely something that states are considering as I think, a sort of incremental step towards like what we eventually need to get to. I will say that there is a sort of a debate in the field, in the advocacy community around to what extent we should tie, childcare investments to business that closely. I think in the short term, again, that is a, sort of Band-Aid kind of solution. But in the long term, I think people are worried that, when employers, even the most well-intentioned employers are doing this, like at the end of the day, it mostly benefits their employees. So if you're a family who happens to work for a great employer that's doing this, great. But then if you change jobs, if you move away, then you lose that benefit, and then you're not, so we need a systems kind of like approach, a systemic kind of solution at the long run. So if we can allow ourselves not to get distracted by kind of latching on to these things, full, sort of full hog, then I think it could be an incremental kind of like strategy. But in the long run, I think what we ideally would want is the business community to advocate for public investments alongside advocates, and providers and educators and families, right? Like some people compare it to healthcare. Like if, we know that it's a really big problem when we tie healthcare benefits to employment, which is basically how it works right now in our country. And do we really want to replicate that sort of strategy for childcare? And a lot of people would say no. But again, I think depends on how you use that strategy, I guess, is the
Yeah. And Albert, Annie was also kind of a follow-up comment. Are there any states looking at coordinating investments to maximize impact and mitigate inequities? And I think your message, and I think is sort of don't overly rely on it as the solution. Put it into the mix, but as employers investing, but we need to be very careful about over reliance on the private sector to businesses to pick that up.
You don't want the business leader or the policymaker to say, okay, we fixed it. Like this is the great
right. Businesses will pick it,
and we're done. Like this is enough. And no, it's not enough. And like we need you to do, actually more. So I see it up as well.
Yeah, Christy Vandergriff.
Hey everybody. Albert, you're a rock star. So I'm a policy nerd, and I read other people's development block grants and read everything I can on child care and Head Start for fun. So I'm interested in reading all these links, and I dropped one in the chat that was actually that a bipartisan group led by Linda K. Smith came out in February, which is pretty awesome. And for y'all that don't know who Linda K. Smith is, she was head of child care, Health and Human Services for a number of years, and she's one of the folks who brought the child care partnerships into play with Head Start and Early Head Start. So she's pretty awesome. I did want to mention too that I've done a lot of advocacy work on behalf of the National Head Start Association. And one of the things that they've developed for us, for states, was a list of best practices or innovative strategies that are happening in other states, so that when we do go out and we make visits to legislators, we can give them a summary of what is happening in other states and how that's working. And then I also wanted to mention too, just briefly, just from my experience in the city of Chattanooga, we do have a division of workforce development. And here I'm in early learning, and they're having meetings with childcare programs or folks who want to start a childcare center, instead of like sending them over to us. And we already know that the state has these groups and they have resources to help providers to set up a childcare center. Workforce development's kind of out there on their own. So I really think there needs to be more conversation at the local and state level with workforce development, so that we're not replicating services. And then lastly, I wanted to mention Head Start, which Head Start just recently came out of a notice of proposed rulemaking, which is probably going to go into effect in October. And it addresses specifically pay parity and mental health for staff. And I know that doesn't have a huge impact on childcare. It does in a way in these childcare partner sites, but Head Start seems to lead the way. in a lot of things. And so I think it's worth noting and looking at what folks are doing for pay parity. And I know they're encouraging Head Start programs to cut slots to address pay parity. And that's what we're looking at here. I mean, nobody wants to cut slots, but the reality is if you can't recruit and retain a workforce, you know, you're going to have to do something. And I did love that model that North Carolina was looking at. And our Ariel Ford, who used to be over our early learning department here at the city of Chattanooga, is over there at North Carolina. So anything she posts on Indeed, I'm going to, of course, read. But again, thank you. And I hope we can get Albert back sometime. You're awesome, buddy.
I appreciate that. Thank you.
He is awesome. He is a rock star. You're right, Christy. Anybody else have questions or comments, thoughts they'd like to share with the group?
Hey,
But-
Blair, I wanted to say something too about that
Yeah.
child care development block grant. So,
Yeah.
you know, that's on a 3-year cycle, Kathy. And we just had the public comments just closed for it. And so they sent out the blank document and they sent out the one from last time. And so you had to submit public comments, but there are going to be public hearings and that will have to be approved by the Young Child Wellness Council. And there's a lot of people on that Young Child Wellness Council. So it goes before that council for approval before it's submitted. And the DHS will post it on their page. And somebody's just going to have to really watch the page, because I noticed what they did is they posted it on their page. And then when it got closer to time, then an email went out to providers, but it really didn't give you a whole lot of time to, you know, to get in the webinar or Zoom meeting that they had to make comments and stuff. But I mean, that's really the only way that I know to influence those dollars. And Blair, I think you're right too, because there was a 15% increase in the block grant funds during the Trump administration. And I don't know that we're going to see an increase if they can't even pass a budget in Washington right now, much, you know, less add childcare dollars. But I do think there needs to be some advocacy at the national level. We may have to tie in with Childcare Aware or something, do some national advocacy work.
Yeah. Other comments or questions people have? I know I know Jonathan wants to get you in your breakout rooms to have a little bit of regional discussion, right, Jonathan?
That's right. Yeah, just I know we're getting ready to do breakout rooms for a little bit, and want you guys just to discuss kind of how this pertains to you. A lot of what we've talked about is at that state level, but would just love to hear from you guys as you talk about these things in your groups. What are the things that resonate with you? And we'll give you a few minutes to kind of think about that and talk about that. And then we'll bring everybody back together and kind of share some of those comments back out. So as you head into breakout rooms, just ask that you do assign or do appoint somebody, whether it's the fellow or whether it's somebody else in that group that can kind of be the spokesperson as we go around the room when we kind of come back. So with that said, any other questions or comments before we send you all into breakout rooms?
Jonathan, I'll just say, obviously a quick thank you to Albert, and he's agreed he's going to just kind of work on his emails, and then he'll be back with you as you come back from your breakouts if there are any other questions. But I just can't say enough about him, and I know we're also appreciated. I could tell you all are as duly impressed with him as we are, and appreciate him. So thank you. I actually am going to step out. I won't be back after the breakouts, but thanks to everybody for your comments and for your engagement and your passion and your work on this. Really appreciate you all.
Perfect. Well, I'm going to give you guys, you'll have a total of 10 minutes. So there'll be a 9 minutes. It'll say that it's closing, and then you'll have like a 60-second kind of warning from there. But feel free to talk about it. And there's also the feature that you can kind of magically whisk me into a meeting if you need, ask for my help, and I can come in, and if you've got any questions or help that I can provide as well. So I'm going to open up these breakout rooms now. All right, we'll see you guys in 10 minutes. Good to see all of you come back. Hopefully, you know, it's always fun to be in the room back here in the main room and to know whether, you know, were you in the middle of some deep thought or, you know, were you just kind of sitting there hoping that we would close these rooms out as quick as possible. So there's nothing in between. It's just one of those two options. So Glad to have you here. Want to use this time, and we will definitely not use the remainder of the 40 minutes here, but want to use this time to see, one, if you have any further questions for Albert while we've got him, and two, use this time as a cross-pollination time to kind of share back out thoughts that you've had, things that have, ideas that have been spurred within your Bright Start community, that, conversations that you guys are having. The third thing, I said two things, but the third thing actually that I want to add in as well is a lot of this today has been really state level focused, right? So there's not as many things that you guys can take and implement in your community. I know Memphis has been an exception to this with some of the things they've done in regards to not compensation, but in like regards to pre-K, where they've said, hey, look, we're going to fund this ourselves. And they've done that with First Aid Memphis. So there are things that you could potentially do locally, but this is hard with compensation. And so the third thing I would ask for is feedback on some of the things that have been mentioned here. What are the things that you think your community would be most excited about? And this is an informal way to gather this, and we will do this more formally like we do every year. Once session closes, we'll start to get the feedback process on what we should consider for our for our TQEE policy blueprint, and then how that feeds into our legislative agenda. So hopefully you've had somebody being appointed to kind of be the share person. We won't go through every single community. So if your community doesn't feel like you have something to share, that's fine too. But I'll just kind of open this up. I'm recording this now. If there's at any point it makes sense for me to not record this, I'm also happy to turn the recording off as well if you feel like you want to have more deeper conversations for that as well. So let me just open it up. If anybody wants to go first or has something burning on their mind or heart.
Memphis and Shelby County can go first. I think from our discussion, we all acknowledge that, childcare is not an issue that's prioritized really at the state level. And so for us, that means looking at, there was a suggestion at creative ways to get around that. For example, maybe regionally or, across the state, organizations can pull together money to create a funding for compensation. Or also leaning into the idea of contracting with service providers to ensure money does go to compensation. And then on the research side, just taking a look at a starting point of the states that were mentioned in Albert's presentation, and finding out like what states are similar to Tennessee, what have they done, and are also those states no tax states. And so starting there as a sort of like a comparison. Those are our thoughts.
Fantastic. That's great. Thank you so much. Yeah, and if you don't mind, come out, just say which region you're from and name an organization. That's great. So thank you, Trudy. Others?
I'll go, Jonathan. So we're Northeast Tennessee. We had a good conversation. It was brief. We probably could talk a little bit longer, but it was good. A couple overall thoughts is we enjoyed hearing what other states were doing, giving us ideas, knowing what else is happening out there and what is possible for our own state. So the information could be overwhelming. We're excited to dig into some of the links and see what works for us. Something that we really feel is important is the data piece. And so whether it be if DHS will not be doing the data, TQE or a private organization doing that cost of quality childcare analysis, we think that would be extremely helpful as a first step. And I hope Jennifer doesn't hear me sharing this, or Jennifer, you're welcome to come off mute too. You had before we left, you had something that I thought was important for everyone to hear. Do you want me to share or do you want to share it?
You can go ahead. That's fine.
Okay. Sorry to put you on the spot. So Jennifer does work in a position where she is hiring teachers and really working with teachers, living with this huge issue of compensation. And so while these conversations are great to have and they're inspiring, and we know that this could be a long journey ahead of us, she's in the position where, she needs something now. We need action now, because for the people who are actually living this really difficult time, these conversations are important to be having, but sometimes can be frustrating at the same time. Jennifer, did I say that okay?
Oh, absolutely. I
Okay.
think it's just, I would love to see, I would love to see being able to move the needle, sooner rather than later. Because at the end of the day, we don't want empty classrooms because we don't have positions filled. We don't want, we want to be able to make sure that our educators that are doing some of the most important work out there have a great quality of life outside of work. And all of that comes into play.
This reminds me, I popped in for a second with in Knoxville with Debbie Dillard. Just if you want to speak to kind of what you were talking about.
Yeah, it really just, I'm in the field. I'm in Knox County. I serve, all of Tennessee or East Tennessee, all the Eastern time zones in Tennessee. And it doesn't matter what county I'm in, what school I'm in, it is the same conversation. Debbie helped me figure out a way to make my tuition not too high, but raise my salary rates as high as possible. How do I get people in the door? How do I keep them from ghosting me? Where are all the people? And then also walking by classrooms. Oh, this one's closed. I'm like, oh, you don't have children? You have a wait list? Oh, yes, our wait list is 200 children long, but we don't have an adult. And so I was saying that my sort of right now, my conversation in my head, and also as many people that will listen to this crazy idea, but perhaps we need to go to the high school level and do more of a, back in the day, I'm 55 years old. I would leave school and go to work, co-op student, if you will, and pay students to do these ECE work that we are asking them to do. And I thought, how cool would it be if early childhood classrooms in the high school level were the coveted thing to do because you earn money while you were at school. That's
well, I think that would be awesome if licensure didn't say they had to be 18.
Right. And maybe it's not like a paycheck, but a stipend to say, thank you for this. Thank you for and we could call it anything, either a scholarship, for continuing education, or I think my point is getting them interested in doing it by paying them, but also just elevating the need that this is a hard field. And we need to pay if we can. And I know it's a different concept, and I'm from a different generation, and co-op is, I think maybe coming back in some rural areas. I saw I'm in rural parts all the time, and I'm seeing nurseries, not preschool nurseries, but planting nurseries, where they're starting to bring those back, and auto body and those types of things. So I would love it if we could just get on those coattails. I'm sorry. I'm not feeling great today. So I'm not speaking my words very well, but I just wanted to say that. And I try to help the directors. I feel for them, but I don't have a lot of answers.
I don't know if there are any local jurisdictions or at the state level in Tennessee that's looking at career and technical education strategies as a way to grow the workforce from high school upward. But there are places in, states and school districts where there's a track for CTE where if you're interested in working with young children, you can be you can do that and take some coursework, get some practical experience, and then in some cases they get a CDA credential at the end of the process, and then they they can work in a program if they want to after high school, whether it's part-time or full-time or whatever. So and then pre-apprenticeship programs could be could be helpful too for that population. So
I know Tech is trying to do that a little bit slowly.
And we covered the CTE track. It was the first, I think, topic that we covered in this community of practice. So the CCTE, and then we've got the folks in Northeast Tennessee are actually piloting with Niswonger Foundation, looking at an online version of the CTE. So they're working on CTE 1 and 2 that they're in the process of developing as well, that could be utilized. The last piece I'll say on that too is that it's still in the thunder a little bit for my final announcement, but is that next month, or I guess 2 months from now, when we connect in June is that our community of practice will talk about early educator apprenticeship programs. And so several of you have been on different calls in regards to the Department of Labor's grant RFP that's out right now. I think that we're in the process of kind of looking and partnering together with Grow Your Own, TQEE, to potentially put together a statewide application for some of the Department of Labor apprenticeship programs to kind of pull that together. If you are hearing about this for the first time and you're interested, don't hesitate to email me and we will get you connected as we need to. But I'm looking around and seeing a lot of faces that I think have been on some of those calls for planning for that. So yeah, let me pause. Are there other communities? I know we've got a couple of them in here, but are there other communities that have questions or thoughts that you want to share as you've been kind of thinking about how this relates to your community, or thoughts you have on state policy stuff?
Jonathan, I can speak for Chattanooga, Hamilton County. We really were stuck on the cost of quality care provision and how that is absolutely something that we need to calculate. So I would just flag that, let us know if TQE is going to take that into their own hands, because if not, we're going to do one locally. We might do one anyway, because I think the more information we have, the better and more accurately we can advocate for future investments.
Got it. Noted. And we will let you know for sure. Other thoughts, comments, questions? I also take snide remarks, but they have to be directed at me specifically, not to our guest speakers or anybody else. Jasmine, you put your head down.
Jasmine, you were
Fantastic.
too quick to.
I know, right?
do
That was I was watching her panel when I said that. That's exactly who I was watching for. Fantastic. Well, let me say this. I did drop in the chat a link, and I would just love for you to take the 60 seconds, help us evaluate this. This makes these better when we can kind of hear from you what you've learned. It really shouldn't take any longer than 1 minute to fill this out, but it helps us to make these better and more relevant for you. So as you're closing out, take that in mind. Also, so next time that we meet will be the first Monday on a Friday, or first Friday in June. So is when we're going to connect again, and we will be talking about apprenticeships. We'd love to have you back, or the people that are connected in your community to this work that would be interested in learning about apprenticeships. Back to this conversation. Many of you, I think, have alternated your strategy team meetings, or those of you that are kind of call them different things, for the opposite month that we meet as a community of practice. So hopefully you'll have one of those in between. If you are new to this place and you're wondering if and when your team meets, what that looks like, feel free to email me, and I'm happy to make sure that you get connected to the proper Bright Start Fellow, or the person that is leading the work in your Bright Start community. So with that said, I think I'm going to dismiss you all. I'll stick around for a few more minutes as I kind of close out the recording, and as I close out, making sure I save all the comments in the chat and things like that if you have any other questions. But a big thanks to Albert Wat with the Alliance for Early Success for his wealth of information. He's a wealth of information on a lot of things, but compensation strategies today specifically, just to give those things to us and kind of share that information with us. Really appreciate that, Albert. And we will see you all shortly. Thank you.
Happy to be here. Thank you for having me. Have a good one.